A few weeks ago on this program, we had on Macedo and Lee, who wrote a book looking at the pandemic and all the NPIs, the non-pharmaceutical interventions. And the big takeaway from that book was, other than vaccines, nothing worked. No NPI had any discernible or statistically significant improvement over not trying a non-pharmaceutical intervention. Now, I think the biggest portion of their book, and when people think about, hey, what do we get right and what do we get wrong about the pandemic, what comes to mind first is schools. And an excellent journalist who I've had on the show before has written a book just focusing on COVID, interventions, and schools. The name of the book is An Abundance of Caution, American Schools, the Virus, and a Story of Bad Decisions. David Zweig, welcome back to The Gist.
Thanks for having me.
So I've had you on to talk about some of your eye-opening studies and findings, but it didn't really, I knew you were a writer and I thought you were a science writer, but here in the book, you write that you began reading studies in journals and government reports about COVID. I had no professional interest in the topic. I was more than a year of writing into another book, and I admit we wiped our groceries down. But from my training as a fact checker and my skeptical disposition, I couldn't stop myself from digging a little. Good. Thank God that you did. What did you find? What was your first eye-opening finding of your digging where you said, how is no one else writing about this?
I'm not sure there was one moment, but it was in April is when things started to look awry to me. As you noted in the little excerpt from the book there, I sort of followed along with everything. I live in the New York area. I had no reason to, at least I wouldn't say not believe what we were being told. So we sort of complied with everything, as did most of my neighbors and so on. But something seemed amiss as far as there didn't seem to be in the sort of legacy press that I read oftentimes, there didn't seem to be any real analysis or coverage or digging into sort of what's the evidence behind this stuff, behind these interventions. Again, in the beginning, I wasn't really questioning it as far as like whether this was the right thing to do or not. But as time went on, that began in mid-March when the entire school system in America, more than 50 million kids, shut out of school. So by a month later in April, I'm really starting to think through, well, what's the long-term plan here? What is the actual benefit of these closures? And I kept seeing sort of pronouncements being made in the media and quotes from different, public health experts, but they didn't provide real evidence behind the effectiveness of these things. And that kind of set me on my path.
Right. So to set the scene, you're a science journalist. You're a journalist, but you do a lot that would be considered science journalism, right?
Yes.
And in March, like everyone else in the world, you aren't on the respiratory infection beat or anything like that, but you are a science journalist. And we start seeing reports out of Italy and other places and maybe China. There's a virus. It's big. It's real. And you're like every other citizen doing what you can to get your head around it, but also to protect your family. But you do have this training and these instincts. And perhaps sooner than most people, you raise the question of, well, why is it that they are saying to do the things that they're saying in the beginning? Why is it that they're saying to stay this many feet apart? Or why are they saying that a respiratory illness is acting in this way? I would say that even informed people wouldn't have any preconceived notions of how a respiratory illness is supposed to act. But you knew at least to ask, wait a minute, what does the literature say about respiratory illnesses? And what did it say? And how was it different from what they were saying about COVID?
Right. So you set this up well. And, the reason I call the book An Abundance of Caution is, a lot of us, or probably most of us, heard that phrase used oftentimes as it's almost to some extent kind of like a mic drop. It's like, an abundance of caution, we're going to do X. And it's like hard for anyone who doesn't want to be cautious?
Right. Who has ever argued, no, better sorry than safe?
Right.
No one's argued that.
So the way this was framed early on was this is, and I have a long section in the book about the precautionary principle and what it actually means. I interviewed this really interesting philosopher of medicine named Eric Winsberg, who studies this type of thing. So we got into kind of a deep discussion about what it means to be cautious. And, it's caution for whom, caution in which direction. And there are a lot of assumptions built into that. Now, when you're faced with something sort of unknown, the sort of weights on the scales tilt in a certain direction. But once evidence starts accruing of sort of lack of benefit, perhaps, of these interventions, and on the flip side, evidence accruing of harm from some of these interventions that are opposed, you can no longer claim this is merely the precautionary principle in action. It's just dishonest. It's untrue. And so for me, what's interesting about my book, I hope, to readers, is that the pandemic's the backdrop, but what I tried to do is really use that backdrop. It's almost like a case study of how do societies and authorities and individuals make decisions during a time of crisis or a time with limited information. What is the process there? So that's, for me, is like the lens through which the book operates. And hopefully it's applicable. It's not, for however many of your listeners are like, another thing about the pandemic. This really is about something larger than the pandemic, to my mind.
And I am also anticipating what many of my listeners are saying, which is something like, yes, mistakes were made, and some of them were small, and some of them have been exaggerated. Maybe some listeners are saying some were big. But, it was good people making these decisions. And I swear to you, listener, we're getting into that, but I have to jump on something that David just said. He talked to this interesting philosopher, and they talked about the nature. What is the claim? When you say to have an abundance of caution, it seems so natural. It almost seems like folk wisdom. Are there any trade-offs? And there is a claim in the book. The precautionary principle is a burden of proof claim, says the philosopher you talked to. Tell me what that means.
Right. That when you're practicing a sort of precautionary principle, which some philosophers just don't even believe is a thing, because even the precautionary principle still requires some level of like a cost benefit, where you're making an assumption about the potential harm and risk from one thing, and you're making an assumption about the potential safety and benefits of another direction. So even the sense of the precautionary principle still has at least a kind of like tacit or approximation of a cost-benefit analysis.
Right. You're saying there's no such thing as let's be precautious, let's default to precaution. Everything's just risk, reward, risk, benefit. There's this one category of things that if you're lucky enough to get it labeled precautionary, it seems more prudent to people, but it's not. It's all just risk benefit. And if we were to engage and think about that rigorously, maybe we come to different conclusions.
Right. So I think most people, including me, would say, look, when you have very limited information and something that seems potentially dangerous, that's going to tilt you in a certain direction. And indeed, with the closures that happened initially, the way I would describe them is they were both reasonable but wrong. But when things shifted from reasonable but wrong to just wrong and unreasonable, is certainly there are people can point to a couple different points in the timeline, but if we want to make it irrefutable, it would be at the end of April and beginning of May, millions of children began going back to school in Europe. And in May, the education ministers of 22 countries in Europe, 22, they met virtually, at the EU, and they said, we have observed no negative consequence of these schools being open. Again, we're not talking about a little schoolhouse, somewhere in the countryside in Scandinavia. We're talking about 22 countries, many of them with very large, densely populated cities like Paris. They began reopening their schools. And, within a month, they did not observe a negative consequence. And then they met a second time in June and had the same determination. We've observed no real impact from this. So when this came out, I describe it in the book. I was like a cartoon character at a mirage. Like, it seemed unreal because I didn't see coverage of this anywhere. You would think, because, touching on what you mentioned a few moments ago about, well, people did the best they could. We had limited information.
Right.
This was the information we were waiting for.
Like, how do we muddle through these hard times? Standard ways of doing it is to, if you're one city, you look at how another municipality might have done it. If you're a country, you look at other OECD countries. This is always done on issues like, I don't know, drug decriminalization. Well, Denmark does it, and progressive Americans all know that Denmark or the Netherlands does it, and maybe we're supposed to take an example. Yet when it comes to this, when it comes to masking of school children, which is where I first read about you writing about this in New York Magazine, Europe was doing it entirely differently. And you are right, except for you in New York Magazine, there's almost no coverage of that.
Right. So there are a couple things here. One is the school closures themselves, and then how schools reopen, which is the most important factor. But then we can run through, the variety of other interventions, such as school mask mandates, which I had written extensively about. And
when did the law? You had this stat. When did the Los Angeles Unified Free School District open?
When did it fully reopen?
Yeah, when did it fully reopen?
I believe not until a year and a half after the initial close. So it wasn't even. That
is correct. That jumped out in my book. Los Angeles, not a small city, second biggest in the United States. Yeah. We're talking about in May of 2020, Europe was open. In June, they convened again in 2020.
Right.
There were students in LA who did not have the option to go to a physical school until, April of 21.
Correct. That's a full year later. But many of them didn't even go in that spring because it was like one day a week or a half a day. It was some ridiculous, onerous sort of hybrid schedule. So many of them didn't even attend until the following fall of 2021. Just to kind of step back, that this is such a radical thing that happened. And I don't know, but you're better suited to describe this than I am, Mike. But to my observation, there has not been nearly enough analysis and attention paid to how is it something as wild as keeping healthy children, millions of healthy children, out of school, not for weeks, not even for months, but some of them, many of them, millions, for more than a year, a healthy kid sort of sequestered at home, while at the same time, adults could go to a bar, could go to restaurants, could go to the casinos were open, and on and on. How is it that something this radical continued? So the sort of defense of, well, we didn't know, this, that, the other thing, that maybe was defensible for a month. But by the time this evidence came out from Europe in late April, early May, it was no longer a precautionary principle at that point. We also had two other important data points very early, which was tens of thousands of kids from sort of first line, responders, frontline workers. Their families had never locked down, and those kids, tens of thousands of younger kids, but also adolescents, went to these sort of ad hoc daycare programs, many of them at YMCAs. There was also a program in New York City. Tens of thousands of kids, and there was no observable sort of outbreaks or, rash of outbreaks. And by the way, they were not wearing masks, mask mandates across the board. They weren't practicing 6 feet of distancing across the board. And yet we had tens of thousands of kids here, even in America, in that environment. Surely, if there was not a major negative consequence of that in these daycare centers, we weren't going to see it in schools. And then lastly, Sweden never closed its lower schools. And very early, they did an analysis. And the teachers there were at no higher risk of infection than the average professional.
But the Swedish stats did take a while to work through for them to be compiled. So in the beginning, the Swedish stats were showing that the death toll is a lot higher in Sweden. By the end, it's one of the best European countries, but we didn't know that until far after.
No. But this study on the risk to teachers, because a large part of the argument was that, okay, even if kids aren't at risk, although, and I give a mountain of evidence that over and over and over again how children were positioned as being at risk and that school closure was for their safety, which was false and just disingenuous. But even if we set that aside and say the narrative is, well, kids might infect the teachers, they might infect grandma, and so on.
Yeah, that was the big. Today, my listeners will be saying, no, we know that kids weren't at risk, but of course they're going to take it home, and then they become vectors for contagion, and the entire pandemic gets worse.
So this is a really important point. And again, this is why I hope that people listening will go out and buy my book, that it really studies how we think about evidence, how we think about what is true. It's sort of like an epistemological framework, if to use academic jargon for a moment. But our intuitions are often wrong. And that's especially so within medicine. And I give examples of this throughout history, but also recent history. It's not just like, oh, those uneducated fools from, the Middle Ages. We're talking about very recent history where we continually think that something will work because it has a sort of bioplausibility. It makes sense. You've got a bunch of, snotty kids running around to school. Of course, they're going to bring the virus home and increase transmission. Or, of course, putting a piece of cloth over your face. Yeah, maybe it's not perfect, but that's got to have some benefit, right? What I show is that things that make sense intuitively often are not actually true once you study them scientifically. And very early, the evidence from Europe showed that despite people's intuitions, opening schools did not have an impact on community transmission. And there's reasons for this. It's not just like, oh, we're supposed to take the word of these education ministers. And I get into a whole thing in the book about what's known.
Although, as far as taking the word, at least the Swedish education minister and expert you talked to said she was deluged with calls from American education experts wanting to do the right thing, right?
No, she was. Oh, nice setup there. I was very confused for a minute. Yeah, this is quite extraordinary. The Anna Ekström, who was the head of whatever the title is, but the head of education within Sweden. And I interviewed her and I was like, okay, so your lower schools never closed. You had, millions of kids, out and about in your society. The schools are open. And surely, and I asked her, which education or public health people were reaching out to you? You were basically conducting an experiment for much of the Western world. You had your schools open and people were like, that's Sweden, that doesn't count. Stockholm is a densely populated city where, a significant portion of the Swedish population lives. Make no mistake, it's more densely populated than large swaths of the United States. So, just as one thing, and I looked at stuff with like classroom densities and so on. So Sweden very much, and the rest of Europe very much are useful and appropriate areas to look at. You can't just wave them away and say, oh, that's too different. It's just the epidemiological data just simply doesn't show that. But yeah, right. to my shock and dismay, no one contacted her from the United States. She had people from Iceland and she had people from around Europe chatting with her, checking in, learning about it. No one from America gave a shit. So the idea that you had places where schools were open, yet the people in charge here in America just basically waved it away. It was either ignored or when it was discussed, any number of a long list of excuses was given. Oh, they've controlled the virus or whatever it may be for why we weren't supposed to look at this stuff. And, what I describe in the book is we had a culture where we were basically favoring theory over real world empirical evidence, that they kept insisting in America on keeping schools closed week after week, then month after month after month after month, or putting them in these hybrid schedules. They insisted on doing this and having mask mandates and 6 feet of distancing and so on. While we had, and all this was based on theory. There were no studies showing that this was beneficial, but it made intuitive sense. But when you looked at the real world evidence, it wasn't effective doing any of these things. And
So
there
I
are
want to talk
reasons
about
for that. But
I want to talk about your phrase when reasonableness became unreasonable. Maybe you have a timeline for that, and it's earlier than exists in many people's minds. But when did this happen? Was it when studies didn't back up these interventions, or would you wait until studies more or less definitively showed that these interventions weren't just a null set, were harmful, were having the opposite of the intended effect, were having harms like obvious learning loss for no discernible effect whatsoever? When does the reasonable response become unreasonable in the U.S.?
It became unreasonable once you had millions of children in school throughout Europe. And this was the end of April, beginning of May is when they began reopening their schools. And when you had an official determination at the meeting of the EU ministers in late May, when they said, we've observed no negative consequence of this. And you don't even need that meeting. You can just simply look at a graph of case rates throughout Europe. After schools opened, cases went down. Now, I'm not suggesting opening schools causes cases to go down, but the point is, certainly with millions of children, thousands and thousands of schools open, if this was a real sort of like catalyst for launching the virus, you would have seen some sort of signal. And we simply didn't. This information was available, it was known, and it was credible, and this was known very early in the spring, and it was ignored. So that's when things became unreasonable. And you touched on something, Mike, that's interesting, thinking about studies showing sort of lack of benefit or studies showing harm. In medicine, we all know the phrase, first do no harm. That the default is not the intervention. The default is to do nothing. The FDA approves drugs based on if they are safe and effective. You would never go to a doctor and say, you have some sort of illness, and the doctor says, okay, here are 10 different pills. You're going to take all of these every single day for the next year. I don't know which one of them work, maybe none, but you're going to take all of them and there are going to be side effects. That would never happen. But that's exactly what the approach was by the public health authorities in the pandemic. Again, there might be a case to be made that that was reasonable for a few weeks very early on. But you would never just give someone a whole bunch of pills without knowing what the possible effects would be. And certainly that's the same thing with these public health interventions. When you flip a master switch in society, it's not just about, well, it's better than being dead. That's not how things work. You drive on the highway, the speed limit is not 35, it's 55 or 65. Why? Because as a society, we're willing to tolerate some amount of death in order to get places faster. We have all sorts of things in our society.
The fact that there is a highway itself speaks to that.
Right.
Yes.
We have all sorts of things that are not structured around how do I avoid death at all costs? Otherwise, I could avoid getting hit by a car for the rest of my life if I just never leave my home.
But when the politicians ask the epidemiologists or the public health community will default to how do we limit or eliminate death. They won't talk about Anthony Fauci's job is not to talk about learning loss, except maybe in the abstract form, how it somehow plays into, future
Correct.
down the road.
The incentives for
Yeah.
Fauci, the Anthony Fauci's incentive, and I'm not ascribing ill will to anyone, but we need to think through and have an awareness of what people are incentivized to do. Anthony Fauci, Deborah Birx, and more broadly, the public health establishment in the US, we're not going to be graded on what happens to a mom and pop business that goes bankrupt because no one shows up. They're not going to be graded on a high school senior in the Bronx who's from a low-income home, who was a football star and was counting on his senior year season in order to get accepted to college. And then school's closed and the season is terminated or never begins. And that kid doesn't go to college and his entire life trajectory is now changed. They're not graded on that. They're only going to be graded on these specific metrics, particularly cases, and then if you think about hospitalizations and so on. So they have no incentive to think through, and Anthony Fauci admitted as such. He said, I don't concern myself with economic things. But economics is part of health, of course, particularly over a long term when you are having these really, really major interventions imposed on society. So one of the things I talk about, Mike, a lot in the book is the idea that the directors of our response were from a very narrow lane of society. One could even argue that Anthony Fauci was not the appropriate person. He doesn't have an expertise in sort of non-pharmaceutical interventions. He doesn't. He has some expertise related specifically to viruses and to infectious diseases. But that's different from having an understanding about the functions of masks. That's different from having an understanding about what happens when you close schools. So
right.
even that, was very narrow. And people, health economists, educators, other people who can sort of game out what are the effects of doing these interventions, those people were largely excluded from any sort of, serious component of the decision making. And not only were they excluded, but oftentimes maligned and dismissed. So someone like Emily Oster, who's an economist at Brown, who is trying desperately just to gather data because the government didn't care enough to bother doing it itself. So she's just pulling together data from schools. And I was at a party a little while after the pandemic began to wind down, and there was a New York Times reporter there, and she was like, Emily Oster, why would we listen to her? She's an economist. I only listen to epidemiologists. And I'm like, you are describing the exact problem with everything that happened at the New York Times, is that you had a few people on speed dial and everyone else was ignored. So anyway, side point, but.
So as far as the public health messaging, to take the mask example, Fauci first comes out with the statement that you don't need to wear them, and then they endorse the wearing of them, even cloth masks. And this is seen as, and I think you even describe it as something like a noble lie, or the ultimate aim is to keep enough PPE for the first responders. But you say that the communication should have been different. And, you're right, it's hard to overstate the damage from the episode of the toing and froing of whether to have the mask mandate or not. And a lot of people say that ruined Fauci's credibility. And you're right, had Fauci and the CDC said, there is no evidence this will help, but we ask everyone to give it a try, I don't know. Is that really how public health could possibly penetrate the public consciousness? Aren't public health communicators, in retrospect, when they get it wrong, we could criticize them for being too certain. But does public health messaging even have a chance if most of it is so conditional and wishy-washy and always shot through with the idea that, but we could be wrong?
Well, there's a gradation there, but I think we saw that going in the other, if you're making a case for the idea that they need to present a degree of certainty which is unwarranted in order to get people to act, that's incredibly dangerous and damaging. And that's exactly what happened.
That's right. Just think a year or two ahead. What if you're wrong? Like that would be a question to have asked all these people who came out with these pretty stark pronouncements. So what if you're wrong? What happens to you the next time you ask people to do something?
Right. And what they might say is, well, better safe than sorry type of thing. But that doesn't, that destroys...
Which is good people trying to do the best. Also, have you seen the votive candle of me? Yeah.
Right. So that's the reason why I think honesty really is the best policy when it comes from public health and from medical professionals, that you can't BS the public for forever. You can do it for a little while, but eventually people start to see that things don't work. They saw, for example, when the school was closed, but for your kid, but the other kid who lives down the street, who's in some private Catholic school that's not doing mask mandates, not doing anything else, and they're fine, and the kid's in there month after month while your kid's locked in their bedroom, eventually people start to lose faith in the public health establishment. When they make pronouncements with such degrees of certainty, everyone must do 6 feet of distancing, for example, instead of saying this is, early on, the American Academy of Pediatrics had a pretty measured and reasonable guidance for schools. Very early, they said, look, I don't know if it was in the guidance or then in a subsequent interview, which was like the next day after the guidance came out, but one of the people from the AAP, but the guidance said, no matter what, get the kids in school. That was the message. And they also said, don't worry about 6 feet of distancing. If you do 3 feet, that's good enough. There's not good evidence that these additional feet are going to make a difference. But once Trump tweeted, like a week or two after that AAP guidance, once he tweeted, schools must open in the fall, with all caps and a bunch of exclamation points, that was it. Within days, the AAP reversed its guidance. Gone was the idea that you don't need to worry about 6 feet of distancing. Gone was the idea that no matter what, let's get kids in school. Instead, they said, just listen to the experts, and we need a massive amount of money. So,
right. And you even quote an expert who says something like, if Trump's real design was to get people to do the opposite of what he seemed to be advocating, he played that perfectly.
Yes,
because of who Trump is and how we regard Trump and how he communicates and how at each other's throats we are in our polarized society.
Trump, it was such a hated, maligned, odious figure to people on the left that no matter what he said, they had to oppose it. And in particular, we saw this with his pronouncement saying schools should open. Once he said schools should open, he ensured that schools in half the country would remain closed.
Yes, and this, I think, is the fundamental reason why, if the question is, why did Sweden have a better response? It wasn't because of their response. It was because they are Sweden and we are America, and they are a high trust society and we are a low trust society. We're always going to fracture around these polarized lines. You have a great stat in there. A Gallup poll in 2020 showed Democrats thought the share of COVID deaths for people under the age of 25 was 87 times higher than the actual stats, because we're so polarized and we go so overboard to oppose our rivals that we come to totally unscientific, but also really, oftentimes really harmful conclusions, just in the name of, well, if that guy says it, I'm doing the opposite.
Right. But for me, what I focus on is, and I appreciate you're describing this in a sort of nonpartisan, neutral manner. And you're right, this happens on both sides of the spectrum, the political spectrum in the States. However, what's of interest to me and what I think is really important is that the people who control might be too strong of a word, but the people who have the most influence within the legacy media, which itself has an enormous amount of influence on decision makers in society, and the people within our public health establishment, almost to a one, uniformly lean left, with some rare exceptions. And these are the people, it's very easy for us to sort of complain about Trump or complain about QAnon. They're giving this information. To me, what's important is what I critique and go through in my book, and what's hard for, I think, a lot of people to accept is people on the left, and not just the left, but the most sort of elite and trusted members of our society, the people with PhDs, the people in public health, the people who went to Yale and Brown, who write at the New York Times and so on. They also deeply, deeply misled the American public. And for no small part, that was as a sort of reactionary positioning against Trump. They admit this out loud. I have the example of the AAP reversing its guidance that I just mentioned. There are many, many other examples of this. So to me, Mike, that's what's actually interesting. People are like, why aren't you writing something against Trump? Well, that's boring to me. And it's easy. Yes, he says false things all the time and QAnon and whatever else. What's far more important is for us to question and understand, why is it that the people who we're supposed to trust, these people, the quote unquote good guys, why is it that they failed so spectacularly? And it's a bit convenient. It is a reason when we talk about reacting against Trump. That is not an excuse. And that's what's deeply problematic, is that even the smartest people among us, or ostensibly the smartest, are still incredibly tribal, incredibly beholden to sort of fitting within their social and professional team, so to speak. And what we see is that most people, regardless of their education and their credentials, rarely, very rarely, are willing to tolerate going against the accepted narrative?
Well, it's okay, I would say, if these institutions lean left. There are probably plenty of reasons. And if you become a scientist, or you're going to, in the 1990s, are you going to align yourself with the party that's trying to stamp out teaching evolution in school and denying climate change and so forth? But I would say, so, these institutions, like, and you listed a couple, and one was Brown. Emily Oster came from Brown. New York Magazine is a left-leaning institution. They published David Zweig.
These are the exceptions, not the rules.
The countries of Europe are all more left-leaning on almost every measure than the United States. The problem isn't so much the inclinations, the political inclinations, the worldview of the experts. It is, in my opinion, an institutional clampdown and reaction, thermostatic reaction to perceived threats from the right and Donald Trump, et cetera. And especially during the pandemic, I hope we have the wisdom to see, we got into a never-ending eddy where it just spun tighter and tighter, and the more that the right or someone associated with the right said this was bad, the more dug in the forces of the left said, no, it must be good. And I fault our institutions for not relying on the usual or traditional ways of truth seeking. So in journalism, it's, as you know, going to the evidence or not relying on narratives. And in the institutions of higher learning, and Leon Macedo said this, it's self-analysis. It's not always perfect, but as they write, there were no discussions. There were no big panel discussions. There were no big events on college campuses, still aren't, asking how we got wrong. So I think that you could be, since people will have a left or right lean, you have to trust your institutions to have some game plan and to have some theory of knowledge that gets past these human inclinations. That's what I think.
Part of it, you're right, but it also depends how we're defining the left. And if we think about what a traditional, sort of liberal position is, it's one of inquiry and of critical thinking, or at least, in an ideal situation. That's not what we saw. So I don't care about the political leaning of a particular scientist or academic or newspaper reporter. I care about what their, as you said, their truth-seeking process is. And, one of the things I talk about in the book that I find fascinating is, it's not just about the political leaning. There also is some degree of self-selection of who ends up at these elite institutions, like a place like the New York Times or, Brown or the CDC with PhDs. And these types of institutions, and also particularly so medicine, self-select for people who tend to be rule followers. They tend to not want to stand out and be an iconoclast. If you're a resident,
yes,
you cannot question the attending. That's not generally tolerated. You must learn from your superiors. There's now these people, many of them are very smart. They're very dedicated. They work very hard. So I'm not questioning that. And many of
their personalities are high in agreeableness.
That's right.
A lot about this, yes.
Or if not agreeableness, in an interpersonal sense, then certainly from a sort of self-preservation sense. Like, how do you get to be a really well-paid, successful person in some of these fields? To some degree, or a large degree, you get that way by understanding how to play the game. I mean, these people, how do you go to Yale? Well, you have to get straight A's through all of high school. You have to know how to sort of be an insider. So you have these institutions with a lot of influence, all sort of almost uniformly leaning one way politically, which is not necessarily a problem unless they're also composed of a certain personality type where they don't tend to go outside the lines, where they had their success by following the rules, by not challenging norms. So that's, to my mind, a large degree about why you weren't going to see some editor, because I had people talking to me, Mike, editors at the New York Times, and I had plenty of people, at elite sort of medical institutions like Columbia or UCLA and so on, where they were questioning what was going on, but everything they talked about with me was off the record.
Of course, because the back channel, yes.
Right, because they just institutionally were, or I should say constitutionally, for themselves, they didn't want to be cast out among their peers. So that's a really important thing that, like, the left, I think in particular, just because, again, at least I used to, Mike, associate these institutions. I had no reason to think that the CDC weren't like incredibly learned and critical thinking institution that, they're not going to steer me wrong. Where we might have more skepticism for the Defense Department or for, the NSA or whatever else. When you think about public health, I used to think of them in a far more neutral manner, and I no longer do. And I think my book makes a persuasive case why none of us should view them in that neutral manner.
I also think it's notable that it was during a time when there was some rampant ideological claims that didn't get dealt with in a skeptical enough way. And it probably played on each other. The George Floyd protests and the COVID lockdowns, the interplay between them caused more and more radical sentiment to be absorbed into the mainstream and not questioned. But this was a time when there were many claims, and you write about this in the book, that if a claim was made about disproportional impact on Black and brown communities, it would shut down debate. You talk to an LA parent who's Afghanistani saying their conclusion was that if you want schools to reopen right now, that means you are racist against African Americans and Latinos. And you write about how in your school district, the administration used the word equity repeatedly in its communications. An administrator's earlier email stated that equity was the obstacle to elementary school opening full time. And then there was also the constantly cited statistic that Black and brown people were dying at disproportionate rates when it came to COVID, which was true for a time, and now it's not. And that new development has been, I once did a report on this, 20 to 50 times less covered than when it was seen that Black and brown people were more likely to die. I think that all comes into play. Another example is Lena Wen is up to speak at a conference, and she's a very mainstream, you might even say milquetoast communicator on COVID, and people call her a genocider. People say that she's involved in, the mass killings and erasures of communities. And all these people are still, not all these people, but the people that actually were at prestigious institutions still are. The people that were students got hired at prestigious institutions. So I think that it was a confluence of things, and I think they did accelerate the demerits of each other. Each phenomenon really played into the fact that we didn't have enough ballast to say, wait, this doesn't make any sense.
One of the things that you mentioned that's important for me to emphasize, though, is the narrative, as you noted, was that low income and particularly Black families and perhaps some brown communities as well were at higher risk of the virus. So therefore, it's racist if you want schools open, because then the kids are going to go in and they're going to infect, their grandmother because they live in multi-generational homes and they're at higher risk anyway from a health perspective. This was wrong on many levels, of which I describe in the book, which is, and very quickly, number one is the notion that this again was based on the idea that schools were driving transmission, and they weren't. So this whole premise did not have evidence. It made intuitive sense, but again, I go back to the idea that our intuitions are often wrong, and we kept ignoring or dismissing the actual real-world evidence that showed that this wasn't the case. And I explain why that is in the book. It's not just, oh, well, here's the evidence, we're done. There's actually very sound reasoning behind why school closures were not effective over the long term, and there was a lot of literature on this prior to the pandemic anyway, so it's not like this was just sort of made up on the fly. And the second thing is that many of the schools that were closed, they would point to, this is what the community wants. But what we found, there's a guy named Vladimir Kogan, who I cite in my book, who ran a really interesting analysis, which is that once schools opened in a particular district, the opinions of the parent community shifted, and then they were in favor of schools opening, which means that, and he looked into this in a very detailed manner, there was no correlation with, maybe they opened because then cases went down, and that's why. No, it was simply what people tended to favor, whatever the circumstance was in their particular district. So you had almost like a tail wagging the dog type of thing, where the lack of leadership, they would just point to the community and say, well, they don't want it open. But you needed a leader to actually lead, open the schools, and then lo and behold, now people are in favor of it. So the idea, there were many others, but there were all these things that kept being cited, from the risks to the Black community, to the opinions of the Black community, that once you sort of like take just one step back, you'll see that these were unfounded. And the irony, of course, Mike, is that the left, who purports to be the sort of champions of the underprivileged, the champions of low income and Black communities in America, that the policies they advocated for, in particular long-term school closures, these cause the most harm to these kids. Extraordinary, irreparable harm to an untold number of kids in these communities. We see it with learning loss that's specifically exaggerated in these communities and specifically tied to the duration that they were out of school. And learning loss, I know we're running out of time. Learning loss is just one sort of observable metric. There are all sorts of other harms. I gave the example of, the sort of high school senior who couldn't play football and then never got a scholarship and just never went to college. There's all sorts of things that were missed by these kids, and that there was actual harm. And the reality is that none of this had to happen because the evidence didn't show that any of this stuff worked. But the people who pushed for this, they caused this harm. So if we wonder why there haven't been more sober analyses such as mine that really have the lens trained on the left and and by the way, I approach this apolitically. I'm not like some right-wing operative. I'm just saying that when we see these major institutions and the people, just your sort of everyday people on the left in this house, we believe in science, lawn signs. These people, that's a really, really hard thing to acknowledge and reckon with, that, oh my God, I caused incredible harm to these communities that I present myself as being the champion of. They, make no mistake, the people who advocated for these long-term closures caused harm to these Black kids. What a terrible, terrible irony. And this is something that needs to be talked about more.
David Zweig is the author of An Abundance of Caution, American Schools, the Virus, and a Story of Bad Decisions. Thank you, David.
Thanks, Mike.